Hello everyone. I'd like to introduce you to our new blood gas machine that we're going to store up here by our old iStat machine. It is a Heska. It's called the EPOC machine. Here's the machine. The cartridges are kept at room temperature. Let's keep them up here on this shelf. The power cord is here. We can run about 22 tests on the machine on a charge, so there's no need to keep it on the charge, just when the charge goes low. To power the machine, you lift up the lid. This section is called the host. This section is called the reader. The on button for the host is the little red button here. I'm going to press it for about 2 seconds. The on button for the reader is right here. Push it. Once the green light is on, it's good to go. Once we're on here, this is the screen that you'll get. It's prompting for a user ID and a password. The default ID is 1. There is no password, so just enter 1 and push login. The machine, the host, is now connecting to the reader. Just takes a few seconds for it to do that. While it's configuring, we can then enter in our patient ID. I'm going to enter and use the client ID number. Let's just use the number 21456. This is the chart number, and I'm going to push enter, the button here, and then we're going to enter the pet's name. You use the little stylet here, and in the lower right hand corner there is a keyboard icon. We can then spell the pet's name. The words are real small, so bring your reading glasses. I'm going to put in Millie. This is also important that we select our sample type. Millie's a dog, and I'm going to use a venous sample, and I'm going to put in the patient's temperature. Important, of course, for blood gas values, not so important for the metabolic component of the test. Up here in the upper left hand corner of the keyboard, I can open up the numeric keypad. I'm going to enter the temperature of 101.5, and then we're ready to go. The sample that works the best for the machine is the lithium heparin, the green top tube. So you'll fill those as you normally would. Of course, with the blood gas, it's important that we're expedient with running the test. We don't want the blood sitting around for a long period of time, or the blood gases begin to skew. If you were just using it to check ionized calcium or creatinine or glucose or what have you, it's not as critical that it sits around for a while. But of course, we want to try and do this in an expedited fashion. So I have my sample. We also need to prepare ourselves with a tuberculin syringe. The syringe is what's used to put the sample into the cartridge. Again, the cartridge is kept at room temperature. It is in a small foil packet. There are some scored tabs here that will tear. The cartridge is very temperamental. You cannot touch the electrodes. You cannot lay the cartridge down on the table. It needs to be put right into the machine. There is a slot here at the foot of the machine that allows you to slide the machine in. And so you insert the card into the reader and push it with one smooth stroke all the way to the end. It kind of has a little bit of a grab feel to it at the end, and the machine makes a beep. Then, if you'll look here, it will show that it's in calibrating mode. It takes 190 seconds for the machine to finish up calibration. We have about 8 minutes from the time we put the cartridge into the machine to when we have to put in our sample. So there's not a huge rush, but it's good to have your blood ready to go and things set up. So we've got about another 130 seconds, so we'll pause the video. So the 190-second calibration that's happening once I put the cartridge in is about finished. So I'm going to gather my sample. We need to have about 0.2 to 0.25 of sample prepared in the syringe to put in the machine. I have found that it only uses about 0.15, but it's good to have a little bit extra. I'm going to use the tuberculin syringe and draw into the syringe well over my required amount. So I'm gonna pull in here a good 0.3 mLs, and then very critical that we not have blood. So I'm going to work my bubbles up to the top. Grab it. Work the bubbles out, and then if we'll just gently tab to clean off the tip, and then looking close here, there's a hole that perfectly fits the end of the tuberculin syringe. So I'm going to, with gentle force, push the syringe into the hole, turn it clockwise 1/4 turn. Then I'm going to inject my sample slowly until it beeps. Then I'm going to, opposite, counterclockwise, lift out the syringe. Now, it's going to take about 30 seconds for my sample to run. We have a program on our computer that communicates with the blood gas machine and allows us to put the data on a sheet with normals. Those programs are listed here. HESCAView. So if it's the first time in the shift using it, we're going to open that piece of software. And this EDM Lite is actually the software that works the Bluetooth. We then need to match the information from the machine here on the HESCAView. So I'm going to click on Patients, and notice this information will come up. So the dog's name was Millie. She's a dog, and the patient ID was 214. And it's critical that these match the information that you put into the machine. And then you can put breed, sex, birth date, the client's first, last name, and account number, which of course is going to be the same as the patient ID number. For the sake of time, I'm not going to do that right now, but I'm going to click on Save. So that information has been saved. Now we come back over to the machine. And it's telling me that there has been an error. Great. So we had an error. It told me that I didn't do my injection of the sample smooth enough. So I think you need to go smooth and slowly. I think it's just going to take some practice. But now, once we have finished, the results came up on the screen here. There's a gases section. a chemistry section, and the metabolic section. Don't know the difference between chem and metabolic, but anyway, there are all of our values there. There are tabs at the top of the screen. This is the client patient information tab. This is the results tab. But once we are finished, up in the upper right hand corner there's the close X icon here, and I'm going to click that box. It means I'm finished, and what it's doing now is connecting to EDM, or sending the results over here to the computer. And that's happened. It just got the result, and as you can see here, I'm going to open up the EPOC EDM Lite. This is just the Bluetooth capture program. You really don't have to do anything with this because the information is automatically linked to the HESCA View program. What I'm then going to do is to click on the result that I just did. As you can see, it's Millie Dog 21456, and this is the one. And here are the values over here visibly. We can click to select a veterinarian, and once you enter the veterinarian one time, the name is stored there. We can also go back into this information and edit it, but that's a discussion for another time. What I wanted to show is that you can print this. It comes up into a nice little PDF file with our normal values listed and a graph. Notice that this information up here is not all filled in because I didn't take the time to do that, but I would like you to do so. We can go back in and edit this later, but all you need to do is click on print, and this prints up nicely here as I showed you. Thank you. Good luck. Okay, if you do need to edit in HESCA View, highlight in the upper right hand corner there is a work list of all the patients that we've done. I'm going to click on Millie because that's the blood work I'm interested in doing, and Millie's name will come up here in blue. There are two results listed for Millie because one of them was a sampling error, but I can, by clicking here, come in and edit this information. So I can put on here that she's a Labrador Retriever, that she's a spayed female, and then her birth date. This is interesting here because you have to highlight the number. I'm going to put March, that works, 28th, 2007, and then client's information, Steve Edwards. Then it's going to be the same account number, and then I'm going to click on update. So it gives us an opportunity, if you're in a hurry, to come back later and make this whole before you print out the final document. Okay. And so if I didn't give you enough adequate information on this wonderful informational, there is a handy user's manual here, and also the cheat sheet that's listed here. It's very general and I don't think very useful, but it might serve to jog your memory. Something that's very important is, along with the machine comes a service contract, meaning I pay money, just like with our IDEX machinery. If you have any questions or concerns, 24 hours a day, there's a phone number right here at the bottom of this informational. Please don't hesitate to call. Also, if you have a cartridge that errors, I would like you to call them because they told us that they would give us credit for those. Each of them costs about $13. So if you take a few minutes, call tech support, tell them what happened, they'd be happy to then credit us for that lost cartridge. Thank you.